I'm Melissa Fuller with Shape of the City, and today we are at the Community Health Endowment. I'm with Lori Seibel with the Community Health Endowment, and we are going to be talking about the Place Matters Community Mapping Project. Hi, Lori.
Hello.
All right, so talk a little bit about this mapping project. How did it get started? When did it get started? What was the initiative about?
Well, we started the mapping project back in 2015, and we began crafting maps at that point, and we learned a lot, and so we did them again. We remapped everything in 2017, which again, we could start to see if things were getting better or worse, but 2 points don't make a trend. And so now we did them again in 2019, and we're beginning to be able to see how things are changing geographically in our community.
What are some of the big improvements you are seeing over this span?
Well, life expectancy in Lincoln has improved, 0.3 years, but in a lot of places around the country, life expectancy is decreasing, so we should be really, really happy about that. Another area we've seen a huge change has been in prenatal care, which we're excited about because a lot of people have made huge investments in that. And of course, having babies healthy when they're born is a great way to not only make sure they thrive in our community, but they have longer life expectancies as well.
Are there any challenges that have come up or that you've seen with the data?
There are some challenges. We, for the first time since 2015, put our smoking or tobacco use map back in our map book, primarily because vaping is becoming such a public health crisis, and it's something that we have to keep a close eye on. We know that people who vape are more likely to smoke, and people who smoke are more likely to vape. So we know that relationship is there, and we want to really keep a close eye on that. We've also been able to look, interestingly, at healthcare coverage because the Affordable Care Act was implemented since we did the maps the last time. And this is one of the things that shows how great maps are, is because we're able to go to the parts of the community where we're seeing, even in light of Affordable Care Act, the number of people who are uninsured still continuing to increase. So being able to go and really target those areas is a really great use of maps. One of the things that I think is a specific concern is we were able for the first time to map childhood or youth fitness using data from the PACER test that many people may be aware of that's used in the Lincoln Public Schools. And what we know now are there are areas of our community where 40 to 50% of kids, even higher, cannot pass the PACER test. And so that is of particular concern because that does not bode well for long-term health outcomes for kids, even in not only health, but in terms of things like academic success and long-term viability going forward.
Are there other ways that organizations or even your organization can utilize these maps or are utilizing these maps to move forward and make changes?
Almost every organization has some place-based activities, and even organizations we may not think about, churches, schools, places that are really uniquely planted in neighborhoods. And so being able to look at universities, being able to look at neighborhood associations, being able to say what's happening in your neighborhood that sometimes you can't even see on the surface. There are things that are beginning to percolate in a neighborhood where attacking those problems and those challenges early can really make a difference. So anyone that really has a location focused, something where they really believe they're planted and serving a neighborhood or an area of our community can benefit from these maps.
So for viewers out there, whether they're just individuals or organizations, how can they get access to these maps?
You can go onto our website, www.chelincoln.org, and not only are hard copies of the maps there and you can look at them, but you can also go to our interactive maps where you're able to go down to the very neighborhood, the very block where you live and look at what's happening there. And those are often the most helpful and the most interesting to folks.
And one, I guess we missed two, in terms of how were these created? Who are you partnering with?
We are absolute partners with the Lancaster County Health Department and many others. We work with the Urban Development Department, we work with Lincoln Public Schools, we work with the University of Nebraska Extension. And so we are constantly reaching out to folks who have really good data and bringing them all around the table so that we can benefit from each other.
So looking into the future, what are your goals looking in the future in accessing these and utilizing these maps?
We just hope more and more people will utilize them. We believe that you really can love what you know. It's hard to love something you don't know. And if you really understand your community and know it, it's a place that you're going to want to take care of. And so I think it's important for all people to know what their community is like. It's important for them to know what its challenges and its strengths are, and to put their own individual talents and resources into place to make it a better place for all of us.
Well, thank you so much. And again, on it's chelincoln.org to check out the maps. And thank you so much.
You're welcome.
Yep.